Welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for listening today. Our guest in studio is Tricia Paige, Senior Director with the JScreen Program at Emory University in Atlanta, Georgia. After receiving her Bachelor of Science in Genetics from the University of Georgia, she received her master's degree in genetic counseling from the University of Texas Health Science Center at Houston and her certification from the American Board of Medical Genetics. She's here today to talk with us about what genetic counselors do, genetic testing in general, the types of conditions and diseases that can be tested and identified genetically, and also how genetic testing has been helping patients and may be able to help them in the future. How are you doing today, Tricia?
I'm doing great. Thanks for having me.
Thank you so much. Genetic counseling, there are all types of counseling, especially these days, a counseling for everything, you name it. There's a counselor for it. But when it comes to genetic counseling, are we talking about trying to choose maybe the sex of a child or something like that, or maybe determining whether or not a child is going to have some type of disease or deformity?
Right. So genetic counseling, it's interesting. It's really changed since the days that I started. When I began, much of genetic counseling was related to pregnancy and trying to find out if there might be a problem with your pregnancy, or you might pass on a specific disease to your children. Today, though, there are genetic counselors who specialize in many, many different areas, mostly because we know so much more now about the impact of genes on health, and so genetic counselors, we are trained especially in the field of medical genetics, so we have a deep knowledge in that subject area, but we also have training in counseling, so we're able to help people make the best decision for themselves and for their family in terms of do they want testing, what kind of testing, and then also really just adjusting to information that they might learn.
Are there specializations within genetic counseling as a career?
Yeah, there really are, increasingly so. So there are counselors who specialize in cancer. There are counselors who specialize in cardiovascular conditions, autism, people who specialize in neurological conditions, like maybe different ones. There are counselors like myself who specialize in genetic carrier screening around planning pregnancies, people during pregnancies. It's really a really fast-growing field, and where there are lots of areas for people to just develop a really deep set of knowledge. Sometimes genetic counselors will change specialties during a career, which is actually a great thing about being a genetic counselor, because you can do that. But typically, at this point, there's so much to learn that you kind of have to specialize. We can't all know everything.
Okay, so as far as specializing, are we talking people that are involved more in research or actually hands-on with patients, or are we talking about specialists counseling other doctors on how to deal with their patients on a genetic level?
So there are genetic counselors who spend all day, every day working with patients, directly with patients, and then there are counselors who maybe work for a laboratory, and in that situation, they spend a lot of time helping to interpret the findings from a person, and also explaining those results to physicians. Physicians in general, unless they have some reason to have been exposed to genetics, or it's something already really ingrained in their field, then many of them need a little help. We're just trying to understand what a report says, and what it means. And so there are genetic counselors who are directly involved in relaying that information. We kind of sit sort of at the intersection of healthcare providers and the public, and try to bridge that gap for people as much as possible.
Now, what types of diseases can be detected early enough to do something about them on a genetic level? We talk about early cancer and other disease screening, but that is on more of an imaging or biopsy level as far as early detection goes.
Yeah, so it really can vary. So at least in I'll just give you some examples. So in the work that I do, I work with screening people, like couples prior to pregnancy, so that they'll know if they're at risk for something, and then they can take steps to protect their kids from those conditions or initiate treatment as early as possible. But those are typically rare diseases.
Mm-hmm.
Some of them you may have heard of. They're kind of the more common ones, like cystic fibrosis or sickle cell disease. Mm-hmm. But in general, many of them are fairly rare. Increasingly, we are able to look for more common conditions. And you mentioned cancer, and I think that's really a great example. There are many genetic counselors who are involved in the cancer field because there's really proven effectiveness at this point. Not all cancers are genetic in terms of the fact that someone inherited a susceptibility to cancer, but in about 5%, 10% of cases, a person did inherit that susceptibility. And so for them, they usually will develop cancer early in life. It can develop in multiple areas. It can, sometimes be more aggressive. And so figuring out who those people are is really important. And finding out, identifying them really ideally before they have cancer, because there are either surgeries that you can do to reduce your risk, or there's medications you can take to reduce your risk. There's lifestyle things you can do. So cancer is kind of leading the way in terms of things you can really do if you know someone's more susceptible. But there are other examples that are coming along too. And it really depends on, what, again, kind of identifying what people are susceptible for, and hopefully intervening before they have any problems.
Now, you mentioned the importance of identifying people that have inherited or are prone to pass the susceptibility to, say, cancer, for example, on to others. Are we talking about blanket genetic testing when someone is at their healthcare provider or at the hospital for routine or maybe even emergency? It's kind of like if a person gets arrested, they automatically get fingerprinted. You know what I mean? Are we talking about something like that? Is that, would that be what your goal is, or the goal of genetic counseling or the industry as a whole?
So I would say that is not the goal overall, but I'll give you an example of where that is the goal. So there is a kind of colon cancer called Lynch syndrome, or it's a condition called Lynch syndrome that makes you more susceptible to colon cancer and other conditions, types of cancer, but mostly colon cancer. And so now there are efforts underway to set up screening for anyone who's newly diagnosed with colon cancer, and because they can actually test the tumor itself, and it will give you a really good indication of whether or not this person does have this inherited susceptibility or a change in the genes that can cause Lynch syndrome. And so many hospitals across the country are starting to work on doing that, so that we can catch not only people who have that because they need to be treated a little bit differently, but also, on average, 50% of their kids are going to be at high risk. Their siblings, are going to be at high risk. So if they haven't developed cancer yet, then they can have more frequent colonoscopies. And then, we can catch things super early and where they're very treatable. So that's kind of the goal.
And finally, Tricia, you are an instructor at Emory University. Could you talk a little bit about what you're involved in at Emory, and maybe if you are the only program of your type, or are there other learning institutions involved in similar programs?
Right. So I am one of the senior directors for the JScreen program, and JScreen is specifically focused on trying to promote screening before pregnancy. So for couples or people who are trying to become pregnant, we want them to have as much information before they become pregnant as possible if they may unknowingly be at risk for having a child with one of these conditions that can be really devastating. So we're doing it in a different way in that we've set up it's a national genetic screening program. You can access us through the web at JScreen.org, and we subsidize the cost of testing, so it's much cheaper than it would be otherwise. And we're doing all of these things because not everybody has a genetic counselor, right down the road. There's one genetic counselor for every 80,000 people in America. And so there's such a shortage that we just have to get creative about, helping people to benefit from this kind of technology and in a way that, you just can't do if you rely on this sort of face-to-face kind of traditional appointment. So we're pretty proud that we've screened thousands of people at this point, and it's really helped people that again may not have been able to get to it any other way.
You've been listening to Health Professional Radio. In studio today with us is Tricia Paige, Senior Director with the JScreen Program at Emory University in Atlanta, Georgia. And she's been here with us today talking about genetic counselors, what they do, how they become genetic counselors, genetic testing in general, and the types of conditions and diseases that can be detected and treated early as a result of genetic testing. It's been great having you here with us today, Tricia.
Yeah, thanks so much for having me.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.